my friends. Welcome back to Desire Dialogues, the podcast where we dive into all the sometimes uncomfortable but really important conversations about sex, relationship, and intimacy. I'm your host, sex coach Laura Nicole, and today's episode we're going to tackle a topic that many people are a bit embarrassed to talk about, but it's actually more common than you think: premature ejaculation, or what some may jokingly refer to as to pump chump, which can be really offensive and hurtful. So I want to start off by saying, hey, if this is something you've dealt with or you're dealing with, you're not alone. Premature ejaculation is one of the most common sexual concerns among penis owners, but since it's seen as like taboo or embarrassing, many people don't really seek help or like talk about it. So today we're going to break it down, what it is, what causes it, but like most importantly, what are some solutions, both physically and mentally, that can help for you, right? So let's start with the basics. PE, premature ejaculation, it's a condition where a penis owner ejaculates sooner during sexual activity than he wants to, right? So while there's no set time for how long sex should last, PE generally refers to ejaculating within like a minute or two after penetration. So I really want to note that PE is typically categorized into two types. Primary PE means that it's been an ongoing issue since the first time someone had sex. Secondary PE, on the other hand, develops later in life and is often related to specific emotional factors or physical factors that can interfere with the performance. So both types can be frustrating, and a little bit embarrassing and a little shameful. But like, hey, fuck that shit. Trust me, this isn't something you have to suffer through in silence, and there are solutions, right? Like, that's it. It's okay. So let's get into like why it happens in the first place, right? So the cause of PE can, be pretty widely varied. It can really involve a combination of physical, relational, and psychological factors. So let me give you some examples, right? So psychological factors like anxiety, stress, huge contributors, right? And then on top of that, if someone feels a pressure to perform and they're really thinking about how long they're going to last, that nervousness actually creates this like self-fulfilling cycle of premature ejaculation. Really important to mention too, performance anxiety. That can come from like past experiences, where you didn't last as long as you wanted, and like now that worry's there every single time. And then we have physical causes, so conditions like erectile dysfunction, hormonal imbalances, and then also certain medications too can also impact ejaculation. Overstimulation is also another factor, like too much arousal too quickly can cause a quicker release. So then relational issues, right? So with relationships. So sometimes PE can be related to emotional dynamics with the relationship, communication. Maybe one partner's putting a little pressure on it without realizing it, right? And then there's maybe a mismatch in sexual expectations. So, if you're experiencing PE, the good news, there's several solutions, and they're not just about lasting longer. The key is really to find out those underlying causes, and we'll find a strategy that works for you. So I'm just going to give you a few approaches to consider. A couple of the most popular ones include the stop-start method and the squeeze method. So let's get into it. The stop-start method actually involves stimulating the penis until you're about to ejaculate, but then you stop to let the sensations subside. So after a brief pause, you can start again. This practice is going to really help you gain control over your arousal levels and help you delay ejaculation. So another one is a squeeze technique. So this technique involves gently squeezing the base of the penis when you feel like you're about to ejaculate. That pressure is really meant to reduce the urge to climax, right? This can be done by you or your partner during sex and can be done during masturbation as well. Strengthening the pelvic floor. You may have heard of Kegel exercises, usually associated with women, right? But these exercises are just as effective for men, actually. So when you do these pelvic exercises, you're going to contract and hold the muscles that control urination. This improves your control over your ejaculation. So when you train those muscles, you can improve your stamina and delay orgasm over time. So a lot of penis owners find that using desensitizing lube or numbing spray can help delay the ejaculation. These are products that have like a mild anesthetic that reduce the sensation. So granted, they're not permanent solutions, but definitely helpful, right? Definitely to help ease your anxiety about your performance. So let's talk about medication and therapy. So if behavioral techniques and over-the-counter products like aren't really cutting it, there are medical solutions, right? Some people find that taking selective serotonin reuptake inhibitors, or SSRIs, it's actually a type of antidepressant that can actually help delay ejaculation, which is cool. But, I mean, that's the thing. The medication has that side effect. So, definitely, additionally, working with a sex therapist, a sex coach can be extremely helpful, especially if your PE is kind of wrapped up around anxiety or stress or relationship issues. So, communicating with your partner is very crucial too. So like that's really important. Being open about it, the sexual experiences, it really can help reduce that pressure you might feel. And I want you to, remember that sex isn't a race. There is no correct amount of time that sex should last. What matters is that both partners are satisfied and you feel comfortable, So premature ejaculation too is something that I want to mention that when we do masturbate, it's usually we have different types of way we masturbate, right? So if you used to masturbate in a way that you had to be done really quickly, that could kind of contribute because your body is, used to doing it this way and you finish. So it's going to continue to do that until you change things up, right? So that's just a little psychological and honestly, guys, in conclusion, PE is something that so many penis owners experience. At some point, it's completely normal. And if it's affecting your confidence, and your enjoyment of sex, there's plenty of strategies. And I, as a sex coach, would love to help you. So when if you want to try behavioral techniques and breath work, desensitizing products, or even medication, just know there's like no one size fits all, right? The most important thing is that you're kind of taking steps to understand it and you're not letting it define you, right? That's it. So that's it for today, my friends. If you found this conversation helpful or know someone who might benefit, from it and listening, go ahead and don't hesitate to share it. Just remember that, self-compassion and communication are really big keys to building better intimacy, whether it's, with a partner or just yourself. So until next time, stay curious, stay kind to yourself, and remember, there is no shame in seeking the right solutions for your sexual health. All right? Do you desire to be a better lover? All my info is down in the show notes. Talk soon.